Is there any difference between PCOS and PCOD? Can you elaborate what is PCOS? Anybody? Let's make it as an interactive session. Your ma'am have already told me that make it more interactive, ma'am. Don't make it like a boring theory class. So I want you guys to be more interactive. What is PCOS? Elaborate, anybody? Polycystic ovarian syndrome. So what is a syndrome? Syndrome, definition of syndrome. Science students. Yeah, it's a group of signs and symptoms together becomes a syndrome. So exactly PCOS is not a single sign and symptom, it's a group of signs and symptoms which can lead to a long-term complications. So that is why we are here today to create awareness to prevent the long-term complications of this condition in the future, right? So, whoever is having PCO, if I ask them, if a patient comes to me saying that she is a case of PCO, when I ask her to lose weight, what's the common thing she says? Is, I'm not lazy, it's just my PCO. What she says generally, ask them to lose weight. She said that I'm not losing weight because I have PCO. That's a common thing which I hear from my patients. Right? So it's not because of the PCO you are losing weight, it's because you're obese, your symptoms of PCO are not coming down. It's a vicious circle where weight leads to PCO, PCO leads to your weight gain. So this is the most common thing which I hear from my patients. So let's all be tougher than PCO. Today the agenda is that we all will be tougher than PCO and we all fight against this condition, right? So why we are more discussing about this condition? Why it is very important to create awareness about this condition is 1 in 10 women in India are suffering with this condition. That is 10%. 10% is a small number or large? Large, right? 10%. In 100 women, 10 women are suffering with PCO. It's a very big silent pandemic which is going. What is a pandemic? Yes, what is epidemic? Epidemic comes and goes. It comes in bouts and then goes. Right? Pandemic is something it is there all through the year. Pandemics are even more dangerous. Diabetes is one of the pandemic which is happening here. Right? In India. So PCO is a silent pandemic, right? So why we are worried? Because this condition affects the prime ages of the woman, right? It is we see PCO mostly in the adolescent and young age group, where the woman is at their maximum productivity. They are studying, they are doing their maximum. Women has a maximum energy in their prime years. This disease is affecting that prime years where it reducing the quality of our life. So our motive is to improve our QOL. What is QOL? Quality of life. So that's the reason we are here today. Our mission at Mom IVF is to spread awareness and help women take control of their health. We should control our own health. The disease shouldn't control us. We should be able to control our health. How? We will learn. So as I told you, PCO is a silent pandemic. Next. Basically, it is a very under-evaluated and under-diagnosed condition. Most of the people don't know, if they get irregular periods also, they are not bothered to consult the doctor, take an opinion. So evaluation is very under-evaluated. So actually if you take the actual statistic, they say that the incidence is as high as 30%. Because the evaluation is not complete, lot of people don't approach the doctor and get diagnosed, especially in the adolescent age group. So it is very much under-evaluated and underdiagnosed, especially in the adolescent age group. That is the reason there is a need for these awareness programs. So let us decode what is polycystic ovarian disease. It is, what happens? Basically, what is the length of normal menstrual cycle in a female?
28 to 30.
Yes, exactly. Very good. It's a 28 to 30 days. If the woman is having normal, regular menstrual cycles, she will ovulate every month. The ovulation happens in the middle of the cycle. So that's how the normal menstrual cycle range. 1 week before and 1 week after, that means 21 to 35 days of the menstrual cycle is pretty much, we consider it as normal. Nothing to worry unless you have a heavy menstrual bleeding. If your periods are in between 25 to 35 days with normal menstrual flow, then you can consider it as a normal menstrual cycle. But in PCO patients, what's the main hormone in the female? Yes, estrogen is the main hormone which regulate our estrogen and progesterone are two hormones which regulate our menstrual cycles. How many of you have heard about testosterone? Yes. Do we have testosterone in our body? Yes. We do have male hormones in our body, but it is in the very minimal quantities, right? But in PCO, what happens because of the inflammation and lifestyle issues, the male hormones predominate. Right? So when the male hormones predominate, what happens? There will be increase in the testosterone levels or androgens. So what happens when the androgens increase? What happens? There won't be ovulation, right? Egg release will be suppressed by the male hormones. So the cycle length will be prolonged. When there is no correct ovulation, you won't get your regular periods. So slightly your periods will start delaying. So why lifestyle, why obesity, why weight gain? Fat is a precursor for androgens. So once you become obese, there is a high level of increase in the male hormones and there is insulin sensitivity. Our body, insulin will control our, yes. So it maintains our blood sugar levels and also fat metabolism. Once this insulin becomes resistant because of our obesity, this mechanism is deranged and all the other symptoms of insulin resistance will come up, which we are going to study later. So what happens as male hormones increase, you see male type of hair growth as well. You get hair on the upper lip, chin, sometimes acne, because of, again, this is also because of the increased androgens, and in extreme cases you have baldness as well. There is extreme hair loss and you feel like a male pattern baldness. So these are the extreme conditions where these are the signs and symptoms. So you can see here, polycystic ovarian disease is a condition characterized by accumulation of numerous cysts in the ovaries. What happens when there is no ovulation? When you do ultrasound, all the follicles look like cysts. These like pearls. How the pearls look? I'll show you the picture, how the ultrasound picture of PCO looks like. So they look like a multiple cysts in the ovary with high male hormones. So these are the, as I told you, irregular cycles, excessive body hair, acne, obesity, and later once you get married and you're trying for kids, there is a high increase in the incidence of infertility in these patients. Right? This is how, can you see the picture there? It's how they look, it's an ovary where if you see the ovary through laparoscopically and it looks like that, multiple cysts in the ovary. It's a polycystic ovary. Normal ovary looks without these multiple cysts. Okay? So there will be increase in the testosterone which stops the female hormone, as all of you know, estrogen production, which impacts the ovulation and it looks like this. As I told you, the two important hormones which we need to think about it is testosterone. In these women, there will be high testosterone and high insulin. There will be insulin resistance. Is one of the most important things which we need to look for. Which, when you have insulin resistance, the common symptoms which we need to look for: weight gain, you have sleep issues, lethargy, you have poor energy. Like you feel lethargic, you don't feel interested, you don't feel energetic. So you have sleep issues, you have food cravings as well in these people of PCO. Acanthosis nigricans, how many of you have heard about it? 5 students might be knowing this. It's the blackening of the neck. This is the first sign of insulin resistance. If you are having it, that means you have to be getting tested for your diabetes. These are the cases which can lead to future diabetes. So, and metabolic syndrome is a group of syndromes where you have high blood pressure, diabetes and all. So, when you have high testosterone, as I told you, you have excessive hair growth, hair loss, acne, period issues and fertility issues. So, why does this happen? A lot of people first ask me, why do you have gut healthy is very, very important. All of you, please, whoever is in, please concentrate on your diet. Look what you are eating. Your gut health is the main cause for a lot of conditions, even the incidence of cancer in the future. So, gut health is very, very important. So, in spite of that, we are also vitamin D deficiency. Now, we are all sitting indoor. We are studying. Now, a lot of people, I think one of our doctors raised the concern also. People studying in residential schools, I don't want to name the colleges and all, are suffering with PCO. When you take the survey and check for PCO incidents in residential schools especially, where they are bombarding them with studies from morning 5 o'clock to night 11 o'clock, there are multiple health issues which are coming in the girls. Why? Because they are not exposed to the sunlight, they are vitamin D deficient, they are not, everyone will be deficient in vitamin D, not girls. Boys are also being very deficient in vitamin D. So exposure to sunlight, playing outdoor game at least thrice a week is very, very important. So, and how many of you like samosa? Have canteen here? Yes. Why? At least I am happy that she raised her hand genuinely. Huh? Good. So you have samosa in the canteen? No? Yes? Okay. So this is like chips. This all causes inflammation. Consumption of fat food, unprocessed food. Right? These are all very, very... How many of you have cell phone? Everyone. Hey, how many of you? The first thing to do after getting up is to look for your mobile messages. How many of you do that? Before sleeping. See, that's what we are living in. So, at least avoiding gadgets before going to sleep is very, very important thing which we all should incorporate in our daily practices. I don't say that we should avoid it because practically now life is not there without a mobile. It's impractical if I say that don't use mobile, but at least we can limit our screen time, at least limit using cell phone before going to sleep. Why? Anybody can tell the reason why we should not see electronic gadgets before going to sleep? Anybody in the hall? Anybody? I'll be very happy if somebody answers this question. Science students, I can't ask the other stream students, but science students should be able to answer this. Okay? You learn and tell your teachers tomorrow. Okay? So, basically that's how. And how it is diagnosed, we know by taking a detailed history, by looking at the signs and symptoms, and you have blood test. As I told you, you can do a testosterone levels, you have certain hormones which you can test, insulin, all these things you can test, and also by doing the ultrasound, right? So these are the common symptoms of PCO. What are the common symptoms? You have generally regular periods, sleep troubles, mood disorders, weight gain, and excess body hair. These are the most common symptoms the patient present with. As I told you, you have n number of tests you can do in PCO. Mostly it is the androgen levels and the other important thing is women with PCO mostly have thyroid dysfunction also. It's not that all women with PCO will have thyroid issues, but it is very important for us to get tested for our thyroid hormone also in women with PCOS, and obviously blood sugars. As I told you, you can do a transvaginal ultrasound. Unmarried, you can go for trans-abdominal ultrasound, where they're looking like a pearls of a string. We call it as a necklace pattern. Like the pearl necklace they are. It looks like that. A PCO ovary looks like this in the ultrasound. So, as I told, why we are here today again? There are long-term complications with PCO. If we are not rectifying this, or not correcting ourselves, or not correcting our lifestyle, in future there is a high risk of diabetes. PCO women are more prone for diabetes, hypertension, there is sleep disorders, and psychological disorders, because body shaming, they feel not confident because of the obesity, depression, anxiety. All these issues are increasing in these women. And last but not least, there is a slight risk of 5%, 1 to 2% risk of endometrial carcinoma. That means uterine cancer also in this woman. So now rectifying your lifestyle, modifying your lifestyle is getting a healthier you in the future. You are looking for your future. Once you cross 40 years, you are able to prevent all these conditions. So a lot of people give you so many suggestions, like it's because they say that it's because you don't exercise, or you're just being dramatic. Okay, have you tried meditation? A lot of people give you a lot of exercise, lot of opinions they give, lot of suggestions they give. Some people say try meditation, some people say drink more green tea, some people say you just need to sleep more. There are a lot of suggestions and permutations or combinations of suggestions you will get. You're just stressed out, it's nothing serious. You're just overthinking it. Why don't you just relax and take it easy? So you'll get a lot of opinions from different people, and you get a lot of suggestions. But let us actually go through a proper systematic way how you can change your lifestyle. So definitely the key is to be aware. To be aware of the signs and symptoms, to be aware of how to prevent it. We all know the common thing like prevention is better than cure. So we are here to prevent it, right? So lack of awareness leads to delayed diagnosis and management, and early intervention can definitely prevent the long-term complications which I have told you, and also improve your quality of life and empower women. We are talking about women empowerment. Madam is just saying that women empowerment. How can women be empowered? If we have good health, if you are healthy, you can do anything in the world, right? So empower women to control their own health, right? So there are a lot of studies which have been done in these people where when they talk about PCO women, we have seen a lot of people, 67% of the girls are frustrated, anxiety 16%, sadness of 10%, indifference, they are feeling indifferent compared to the other girls is around 2%. So there is a very greater need for education among PCO, right? So how many of you know the celebrities? Everybody. right? So it doesn't specifically target one category, right? It's not like poor, rich, black, white. PCO doesn't discriminate anybody. If you are not maintaining your lifestyle properly, you are prone to this. Here, Sonam Kapoor and Smriti Hasna clearly saying that they are suffering with PCO. Actually, it's very nice. It's very good that when celebrities come out and talk about this because they motivate more people, and also it's not about there are also a lot of celebrities on the western side who also have suffered with this condition. So it's very important to come out and talk and motivate other people how you have overcome this condition, right? Why PCOS is more common and raising among the adolescents? Because of poor lifestyle choices and also environmental factors, right? So poor lifestyle choices include sedentary habits and unhealthy diets. Whereas environmental factors, we have a lot of environmental disrupting chemicals around us, which is disrupting our endocrine system. Just now, madam is talking about sustainability, where plastic is one of the ingredients which disrupts the bisphenol A, which is disrupting our endocrine metabolism and causing a lot of conditions, especially one is PCO, and there is also increasing the risk of cancer. Now we are saying that no plastic to our private parts also. Don't use any cosmetics or any bee wash, all these things to our private parts. It's very important to maintain our normal vaginal flora to be healthy and not get diseases there. So it's one of the preventive mechanisms to prevent genital cancers. And there are a lot of articles also in the newspapers which have clearly said that PCO is raised in the teenage girls, and it is the need of the hour to understand the lifestyle. Poor lifestyle is behind the ovarian disorders in teens especially. So what do you expect when you visit a doctor? The doctor will take a detailed history, ask about your signs and symptoms and any family history of diabetes or hormonal issues, and advise on your diet and lifestyle patterns. So the most important thing which we have come to is the diet. What are the do's and don'ts of the diet? Right? So it's very important to have a holistic approach. Holistic approach include a combination of diet, exercise and sleep. Ma'am is talking about the sleep just now. Sleep is a very important thing. It's a quality of sleep which is very important to regularize our hormones. At least you should have 8 hours of good sleep to regularize your hormones. So whatever you're doing, it should be a holistic approach where it includes diet, exercise and your sleep together. And you should also have a proper plan. How to have a proper diet sheet and plan your schedule. And again, I just spoke with your man where she's saying that at the end of exams, you're not sleeping. So you're not having a proper plan how to overcome the stress of your exams. If you're planning well prior, so you won't be having these issues. So it's very important to have a holistic approach, tailored plans and proper goals. What is your goal? Why you're doing this? What's your goal? Whether it is weight loss or your overall development or your mental is a very big question which we all have. It's very important to reduce refined carbs. That means limit processed food. Anything packed, anything stored should be avoided. Right? When you think about endocrine disrupting chemicals, they say that the packed food lying is also carcinogenic. There's so many endocrine disruptors in and around us. The wash we use, the liquid detergent we use for our clothes, the cleaning thing, everything is endocrine disruptor chemicals, plastic, everything. So we have to be very careful to limit them. We can't avoid completely. At least you can limit wherever possible. So it is important to reduce the refined processed foods, especially breads, maida, where bakery foods are very dangerous, which has refined carbs. And what you have to increase your fiber. Where do you get the fiber from? Yes, fruits, vegetables, and whole grains. These are the things which have fiber, and fiber will improve the insulin sensitivity, regularize your sugar levels. So omega-3 fatty acids, walnuts, excellent source of fatty acids, flax seeds. These reduce your inflammation, reduce your, this very helpful in weight loss as well. Antioxidants, berries, all sorts of berries are very good in anti-inflammatory substances. Spinach, turmeric, right? And these are all combat the oxidative stress and very important in your, we should definitely add these ingredients in your diet. And what to avoid? You should avoid sugars, maida, bakery foods, fried foods, and processed meats. These are the things we should definitely avoid. Right? As I told you, this is the main cause for the inflammation. Advanced glycation end products. This is the root cause of the inflammation which occurs in PCOS. Where do you see this? Next. How many of you love pizza? See, pretty much everybody. Burgers, fries. See, these all have advanced glycation end products which cause inflammation. Smoking, alcohol, fried foods, pizza, chips, all these things, right? So these are the things which we need to avoid, at least limit. Make one day as your cheat day. Other days at least you eat healthy. It's practically probably impossible to avoid every day. At least make at least twice a week or once a week and eat healthy at least the remaining 4-5 days. Let's start like that at least, right? So at home, any fries, anything you fry in the oil has this, causes inflammation. That's the reason they say avoid fries. Fried food is not good, anything fried in the oil. So, and also the nutrients are lost, frozen food. When you keep your food in the fridge and use it later what do you do? Heat it and eat, you're losing the nutrients. So it's very important, see what kind of food you're eating is very, very important. And also eat seasonal fruits. Very important. You can't eat mango in the winter. Right? That means it's not natural. It's artificially ripened. Mangoes are for the summer season. You should always eat seasonal fruits. Okay? So that's very important. And when you talk about the management, as I told you, diet plays a very important role. Second comes the exercise. Third comes the stress management. These three things are very, very important. So along with that, you can also add these things to your diet like berries, flax seeds, methi, tulsi, cinnamon, flax seeds, all these things, honey, these are all anti-inflammatory which can be added to your diet. And what is that? What it say? Move for? So what do you mean by that? Walking. Yes. So one is walking, that means move, do exercise. Walking might be one other form of exercise. It can be cardio. Cardio is very important. What are cardiac exercises? Which increases your heart rate. Okay, cardiac, that keeps your cardiac health in place. These are running, jogging, walking, cycling, swimming. These are very good exercises to improve your heart health. Next is strength training. It's very important for a woman to improve her muscular strength. How can you improve your muscular strength? Yoga, stretching, maintain your hormonal balance. So these all exercises helps to maintain weight, improves your mood and stabilizes your insulin levels. Right? As I told you, these are the 5 exercises which are very important to lose weight in PCOS. Right? And when you think about yoga, yoga is very important. Apart from your physical strength, it also relaxes your brain, mental health, especially the pranayamas. Breathing exercises will calm your brain and makes you relax. So all of you going for exams, do pranayama at least for 5 minutes in a day, which helps you, and these are the certain poses in yoga which can help you relax, and also apart from physical health, it also relaxes your mental health. So these are all Chakti Chalasana. How many of you know this? Very difficult asana, looks easy, right? Yeah, especially if you have a tummy like me, it's very difficult. And the best asana which relaxes your mind is Shavasana. Next. As I told you, nobody answered my question, what happens if you see cell phone before sleeping? How many of you have heard about melatonin? Yes. So, electronic gadgets disturb the melatonin production. Melatonin is very important for your sleep. Once you use electronic gadgets, you keep on watching it, your sleep is disturbed, you are awake. Your sleep cycle is disturbed. So it's very important not to use electronic gadgets in the night. Yes. So, sleep is what? The forgotten pillar of health. We forget about it. We think only diet, exercise, but sleep is also a very important component of our well-being. So, impact of poor sleep disturbs your hormone signals between the brain and ovaries. It also leads to weight gain and PCOS symptoms. So, how to maintain your sleep? Sleep tips are to maintain a consistent sleep schedule, which is very important. Avoid screens 1 hour before your bedtime. Create a relaxing nighttime routine. Probably some reading or meditation. Some breathing exercises will help you to maintain your sleep routine. When lifestyle changes are not important, we come into the play. We help you with certain medications and hormones which can regularize your body. So that's how then we can come into play, where we can use some medications to regularize your hormones. And next, so there is also an option of fertility preservation. Whoever has married, want to delay the pregnancy, has PCO, can always preserve their ovaries for their future use. Science have been so advanced that we can preserve the fertility for later coming. If you want to conceive at the age of 40 also, you have your ovary at the age of 30 years. So you have that option also now in PCO patients. Mindfulness and staying motivated is definitely the key. For that you have self-monitoring tools. Maintain a journal to track your symptoms, food intake, exercise. You can use some apps of menstrual cycle tracking. Celebrate small wins. That means if you lose some weight, treat yourself. And importance of follow-up is very, very important. Come in, talk with your family, friends, communities. We are here to talk. If you have any concern, you can always talk with me. You can also have some open groups. You can talk in the forums and educate others and take support from each other. Knowledge is definitely the power. So, empowerment through knowledge is very important. Early diagnosis and lifestyle management can prevent complications. Knowledge empowers young women to take charge of their health. Together, we can create a supportive environment for those with PCOS. So, this is why early diagnosing and preventing, you're curing so many issues. Premature puberties, in teenagers, you're preventing menstrual irregularities, hirsutism, you're preventing infertility in your prime years, diabetes, in later life and cardiovascular diseases. By rectifying your lifestyle today, you're preventing the long-term complications. So we have a cervical health webinar also which is coming up, where we can tell about cervical cancer, the vaccination for it. We'll share that also. Interested people can join that webinar as well on Jan 24th. So definitely now, your questions definitely matter at the end of the session. So together, we can definitely be PCOS. Thank you. Thank you all for your patience.